there's nothing that can ruin a vacation quicker than a problem with your teeth. And what do? Do you go home early to get to your dentist, take your chances with whatever dentist you can find, or just suffer the whole time? Well, how about none of the above? Our next guest says sometimes you can fix it yourself. And we welcome Dr. Mitchell Josephs to the show. Thanks so much for joining us.
My pleasure.
So you're saying I can fix my own teeth?
Absolutely.
That's a little scary.
Well, whether you're going to Toledo or Tibet,
Right.
It's very important to pack these items in your toiletry kit in your suitcase, because very often you'll wind up in a place thousands of miles away from your dentist.
Sure.
And these things will help you out.
Sure. And we're talking about quick fixes. I mean, you know, obviously I can't perform root canal on myself, but just
Right.
things that can hold you over until you get home.
Definitely, and keep you out of pain as well.
Absolutely. That's important. Now, one of the first things, let's hold this up for a second. You say you should travel with this.
Yeah, this is a digital printout of your x-rays. In modern dental offices today, we take x-rays in a totally different fashion. A computer sensor takes the x-rays, and rather than developing film, it'll print it out on just regular copy paper from a computer. And this you could fold up and put it in your pocket and travel with it. So if you wind up in a foreign dental office,
Right.
they'll know exactly what you have
Ah.
on each of your teeth.
That makes sense, and it's easy to do. What happens, let's start with the first thing, you lose your crown. What do?
Okay, if you lose a crown, I recommend get to a pharmacy, or hopefully you'll watch this and you'll have these things packed with you.
Okay.
But actually, if you buy a denture adhesive like Polygrip or Fixodent,
Sure.
even though those are made to keep dentures stable, you just squirt a little bit, for instance, inside a bridge or a crown, put a little bit inside the shell of the crown, and just place it right back on the teeth, and then you'll be able to buy some time until you get to a dentist.
Wow, that's easy. Polygrip, you can find that anywhere.
Absolutely, and if you find that that's not holding, I recommend this product. It's called DentTemp, and that's a little stronger than the denture adhesives, and that would give you some more holding power until you could get to a dentist.
Great. Now, would that also hold true for losing a filling as well?
Losing a filling, DentTemp is also good. It's a powder and a liquid. You mix it up, and you could just place it with your finger in the hole.
Ah.
And that'll keep air from irritating the nerve of the tooth, keep you out of pain, and also prevent food from getting stuck in that hole.
Sure, sure. Now, what about toothaches? That can be so miserable. I mean, a
Absolutely.
toothache can just ruin everything.
And the one thing you have to avoid at all costs, and you'd be surprised how many people do this, do not take an aspirin and put it next to the tooth. I don't know whose mother told people to do this years ago, but a lot of people, intelligent people,
And
I
just
might
put
add,
it and let it like
right,
melt
it gives
in the
you
tooth.
absolutely, and it gives you a very bad chemical burn. All you
Oh.
want to do is get Benzodent, which is 20% benzocaine, and it comes in many different forms. This is Oragel. There's many different brands.
Sure.
That 20% or 10% of benzocaine is a topical anesthetic. It's very mild. You could put it anywhere in the mouth, and it'll help numb the pain.
Well, that's easy. But what about braces? If you have a mouthful of braces, you break the wire.
Well, a lot of
our
our kids today are in summer camp. They're in
Sure.
sleepaway camp. Make sure you send them away with dental wax. Dental wax is a soft, pliable wax that can just be pulled off in small pieces, and it could just be pressed against any wires or any metal loose parts coming off of braces.
Oh.
It'll prevent it from puncturing a hole in the side of the cheek or the gum.
Wow, that's okay. Now, what about a broken tooth? If you chip a tooth, would you use something like that as well?
Okay, with a broken tooth, a couple of options. First of all, if the pieces are loose, very important to travel with an empty prescription bottle, because anything that comes out of your mouth, even if you actually get hit in the mouth and you lose a tooth, you
wanna
want to put
save
it in a
it.
clean place. And you also
Okay.
want to put an actual real tooth, if it should be knocked out, in milk. Milk is it's not too acid, it's not too basic, it's a neutral solution that will preserve the tooth so it could be reimplanted in the mouth. And a small chip, I wouldn't worry about it, just wait till you get to your dentist.
Right.
Anything more than that where the tooth is sensitive, go back to your DentTemp filling materials, or try even the wax for a temporary fix.
Sure, okay. And also, foreign body jammed under the gum.
Yeah, should you be eating something, and one of the major culprits in foreign bodies is when you're eating popcorn, there's that brown, it's called the
Yes.
husk of the popcorn.
Right.
Well, unfortunately, that is the perfect fit for just below the gum line. And you'll bite on that, it wedges down underneath the gum line.
Yeah.
If it's not removed, you will result in a periodontal abscess, which is a localized infection, causes lots of pain and swelling.
Sure.
I recommend, instead of dental floss, get dental tape.
Oh.
Dental tape is a very wide floss Sometimes it's even called a dental yarn. So try to get in between the teeth and use that to get rid of the foreign body. Now that's going to leave the gum very irritated, so then you want to use peroxide, but not full strength. Half water, half peroxide is a good way to flush out any inflammation and infection from the gums. And then when that's done, I recommend Cepacol. Cepacol is an antibacterial mouthwash.
Right.
And in hospitals where people have broken jaws and their jaws are wired shut for 6 weeks at a time, you'll see this in a lot of hospitals as the rinse they'll use.
Wow, great advice. I mean, really amazing. You never thought you could do this kind of stuff. So pack all this stuff when you go away. Dr. Josephs, thanks so much. Great stuff.
My pleasure.
And still ahead, it is a Music Monday.